This is a case from my neuroophthalmological clinic. This is a 50-year-old woman presented with sudden visual loss and visual field defect without pain for 2 weeks on her right eye. The initial diagnosis was optic neuritis by another hospital. She received 10 milligram dexamethasone IV injection for 2 days in her local hospital, but recovery was not that obvious. The best visual acuity on the right, on both eyes is 20/20. When he referred to our hospital 3 weeks after onset, the past medical history is not remarkable. We checked her eye and found that there's an IPD on the right eye, and the color vision was normal. Here's the fundus of her both eye. So we can see that on the right eye, the margin of the disc, especially on the lower part, is kind of blurry, and the fellow eye looks normal. That's your visual acuity. That's the 100 visual field 1 month after the onset. So this eye looks okay, but the right eye just looks like this. So at this point, what do you think of the diagnosis? It is optic neuritis. We have the peripheral visual field, and also you can see that the visual field defect on this part on the right eye. What do you think?
You should poll the audience. And you can telephone home and ask a friend. So which of you thinks this is an optic neuritis? No one.
You can ask me to give you more information.
You can ask questions, then he will answer. If you don't ask questions, he won't give you the information. Anyone? What other questions would you like? What other information do you need?
The eye pressure, sorry.
Yeah.
Eye pressure?
It's okay.
It's okay.
It's normal. Yeah.
Okay, he's going to
Okay.
volunteer information.
That's the optic nerve and GCC map with OptoViews machine. And we noticed that on the right eye, there's a GCC defect in this area. But the nerve fiber layer is still okay. The left eye is basically normal. Sometimes we notice kind of artifacts on this macular area, but actually it's normal. So when we want to diagnose the optic neuritis, usually we need to check MRI, especially for some cases that you suspect he has other system problem on the central nervous system. It's not very necessary, but in our hospital, because we got many referred patients, we don't want to miss anything, so we usually do the MRI on each patient if we suspect he has optic neuritis. And here's the MRI with contrast. It's normal. And at this point, what do you think the diagnosis? It's not optic neuritis, is it? Okay. So the final diagnosis is eye. If you want to look back to the clinical data, we can maybe you still remember that the deep visual field defect is pretty typical for this disease. So you see this. Longitudinal visual field defect sparing with the fovea, and also it matches the disc changes on the right eye. So the upper part of the disc is kind of pale comparing with the lower part. Because we didn't get the early stage of the changes of this eye, saw another fundus picture from another hospital. They just caught the edema on this part initially. And sometimes the fluid can just go down because of the gravity. So this, you can notice that the secondary, marginal, the blurring after maybe 1 month or a period of time. So the purpose I want to show this case is because we have this OCT angiography, we want to test this patient with this technology. Remember yesterday another neuro-ophthalmologist just mentioned this to us, and he also used this technology to check the NAION patient. On this case, on the right hand, you can see that the flow density on upper part of the disc just got lost quite a bit. You can also appreciate on this skeletonized figures here. And if you look at the en-face image, you can see that the nerve fiber layer just got lost pretty obviously on the upper part of the disc. And we can do the fellow eye as a comparison. Before we see that, we just look at the macula at the same time. So because it has some this GCC loss in this area, we can notice that on this part of the flow density map, comparing with the lower part, the upper part looks, decreased in terms of the measurements. So if we compare these two eyes, it's even more obvious in terms of this capillary loss, this corresponds to the GCC loss and visual field defect very well. So I just want to bring another cases and show you the different pattern of nerve fiber loss and capillary loss, which is different from NAION case. And this is a 24-year-old male who diagnosed as optic neuritis on the right eye. This is the fundus picture. This is the visual field, and we can see that the light sensitivity, the sensitivity loss in the right eye in 30-2 stimulus pattern. And this is the RNFL loss and GCC loss. So that looks different from the previous case, isn't it? And if you do an OCT A, you can see that the nerve fiber loss just kind of diffuse, not sectorial like the NAION patient. And you can appreciate this by en-face image. You can see that there's a kind of, nerve fiber loss in different directions. There's only some nerve fiber preserved in this part. And from the density map, you can also see this feature. The capillary loss just around the disc, it doesn't look like the sectorial loss of NAION patient. That's the fellow eye, which is healthy. So it has a lot of capillaries there. Also, if you look at the en-face, the white part is the nerve fiber layer. That's the comparison of both eyes. You can see that the eye with the optic neuritis just got diffused capillary loss with the nerve fiber loss at the same time. We also want to look at the macula. So the macula has pretty obvious capillary loss. And actually, you can still look at the en-face image for nerve fibers. It doesn't look the health. Let me show you the healthy eye. Yeah, this is the healthy eye. You can see this, nerve fiber pathway pretty clearly. Yeah, but this eye, it just gets worse. That's the comparison of the macula on both eyes. So I think OCT A can help us to differentiate NAION and optic neuritis, and it has the different, mechanism, and it also has the different imaging presentation in terms of capillary loss and nerve fiber loss. So that's the flavor. Thank you.
Thank you. Sure.
If you don't mind looking at your picture,
Sure.
I'm just wondering, right now I presume the blue means it's
This one?
abnormal. The one with the flow.
OCT.
Yeah.
Okay.
The more blue means bad, right?
Right.
Okay. But if you open up the normal one, there's some blue areas as well. Are those artifacts, or
Yes,
does it indicate that there might be something wrong there as
Yes,
well?
we were looking at the some normal subjects and found that even in normal, it still has this kind of decrease, or sort of decreased, capillary numbers. But
Because even in the diseased eye, the superior or the upper half is more blue compared to the lower half, where the defect is more mainly in the top bit. So I'm just wondering, is the blue, if we have one picture, how do I tell that's an artifact, or is it real
Right.
pathology?
because there is not, the large amount of normals as the reference. If you want to know this blue area is decrease of capillary loss or is within the normal range, we need to have the normal reference like we did for nerve head analysis. I think the company should do this. See, we have this green area, which means that's 95%. The interval. Actually, when they did that, they just chose several centers as to collect the normal data. I think more than maybe 500 subjects, and I think we did this also for flow density.
Michelle, you want to comment?
In few cases we have a problem of acquisition when the fundus is not completely perpendicular to the beam. And so when you have a staphyloma, for example, you can have differentiation of the flow density just by the acquisition of the segmentation of the images. So we have to pay attention to the acquisition of the
Yes.
fundus.
Yes, I agree.
Can I ask, in this case, the optic neuritis, was it acute or was it for some time?
Acute. Without any other reasons, we call it idiopathic optic neuritis.
Really interesting cases. So I think similar to what Dan presented yesterday, I think Dan actually presented cases which were in acute disorder. So it's quite interesting to see it, and probably we can have a discussion about how the vasculature actually changes when the disc is swollen versus, for example, the NAION case that you showed was a month. You scanned it a month later.
Right. But when I met the onset patient, I also just do a OCT A scan just as a baseline, just because the poor quality of the image. But I do need this map. This map. Yeah, I just keep it because you can see the nerve fiber layer just got edema, and when you do the follow-up, like after 2 months, it will getting down, and you can see the big difference. And also for the NAION patient, if the upper part is got edema, you can see this changes just on the upper part of the nerve fiber. So that's the kind of feature.
The holy grail for neuro-ophthalmologists would be, can you scan a patient with a swollen disc and then tell the pathology, is it ischemic, is it not ischemic, is it inflammatory, is it compressive, instead of sending away for MRI.
Yeah.
That would be really interesting.
Thank you.